Hello and welcome to the February CONECTboard film, which is going to aim to give you some updates from the February board meeting to make sure everyone is aware of what we were talking about at the board yesterday. As always, the board started with a patient story, and we think as a board it's really important that we have a patient story at the beginning of our meetings, either where we hear from a patient or member of staff telling a story about something that's gone particularly well for a patient, or indeed a scenario where something hasn't gone as well as we would have liked, to make sure that we are clear about the learning that we're taking forward as an organisation from that particular story. This month, the story we had at our board was led by Shirley Smith, our hospital chaplain, and Shirley brought with her the wife of a patient who described really nicely the experience that she'd had in the hospital while her husband was here with very complex needs. He was a patient on ITU, and this lady described how the care she received was very good, and that on the clinical level she was very happy with what had gone on in the hospital, but also highlighting how important it had been to her and her family to have support from Shirley, the chaplain, while she was in the hospital. And it emphasised to the board, I think, how we don't just need to be making sure that when people are inpatients here, we're looking after their clinical and medical needs, but that we're also paying attention to their emotional and spiritual needs. And it really hit home for me personally how important that is for patients and their families, and how valuable the service that Shirley and her colleagues provide within the hospital. So it was a great way to start our board meeting, and a very uplifting start for many members of our board. The board spent a significant time of our morning talking about the current operational pressures the hospital is facing. As you'll know, earlier this week we declared a black alert status, which is the highest level of escalation given the pressure the hospital was under and the high numbers of emergency patients being admitted, and the relatively low number of people we were being able to discharge, which has prevented us from running the hospital as efficiently as we would like. The board, and particularly our non-executive directors, were really keen to understand what the impact of the current operational pressures were on both the clinical care we were providing to our patients, but also they were very keen to understand the impact that it was having on our staff, who were obviously working very hard under very trying circumstances. Helen Ryan, our Director of Nursing, was able to talk through how we're managing to ensure that patients are cared for as safely as possible despite the increased pressures. But we were also very clear that we recognise the pressure that everybody's under and the difficult circumstances that everybody's working within. And the board wanted to make sure that staff recognise that we all understand how difficult it is, and thank staff immensely for continuing to work over and above their day jobs to make sure that wherever possible we're looking after patients despite these difficult situations, and making sure that everyone's being cared for in the most appropriate way, even though we're often working in less than ideal circumstances, with patients being cared for perhaps in the wrong ward area or in an area such as our day surgery unit where we wouldn't normally have inpatients. Everybody's really responded very well, and the board really wanted me to pass on my thanks to everybody in the organisation for all the hard work that you've been putting in over the past few weeks, and particularly the past week that's been very challenging. The board are also fully aware that some of the pressures at the moment are exacerbated by vacancy levels that we have within nursing, so they were very keen to understand from Helen what the work we are doing to increase our nurse recruitment. And as you may know, there is a range of activity going on within the hospital led by Helen Ryan and Maddie Groves to ramp up our nurse recruitment. We've got a number of strategies that we're following at the moment. We've recruited recently this week a large number of healthcare support workers, or HCAs, which hopefully will bring some additional capacity into the ward areas to help with some of the challenges we're experiencing at the moment. We've got a recruitment campaign underway overseas, and we'll be looking to recruit from overseas in the next few weeks. There's interviews going to be conducted to try and increase recruitment from overseas. We've had a successful campaign to recruit staff who want to come back. If they're working outside the hospital but they want to come back and work in the hospital, we've got a number of nurses starting from that campaign. And we've also looking to see what other innovative approaches we can take. So this week We've just done a new nurse recruitment video, which hopefully will help us in promoting YDH as being a really good place if you're a nurse to come and work. So we've got a lot of work underway, and we completely recognise that a key priority for us is to get our nurse vacancies filled as quickly as possible to help improve what we can do on the wards and improve the pressure that everyone's under, and also to reduce our use of bank and agency staff, which obviously hasn't helped with our current financial pressures. So all round we've got a real focus on this, and I'm confident over the next few months we will see an improvement in our position around recruitment. Tim Scull, our medical director, also talked about some of the challenges there are within certain medical specialties to recruit both at consultant and training grade posts. And we also spent quite a bit of time as a board not just talking about the immediate pressures within medical recruitment, but also looking forward and saying how is the medical workforce going to need to change in the future, particularly in light of the changing nature of some of the patients we're dealing with. We're seeing many more patients coming into hospital with multiple comorbidities and long-term illness. And we need to think about the different types of roles that we need from medical staff to reflect on that. We know that the way in which medical staff are trained is changing, and we need to think about how that will play through to an organisation like ourselves. And we also need to think about how our greater working collaboratively with colleagues with GPs and community services, how will that change the way medical staff roles are developed within the hospital. And we've already seen some steps forward in that with recruitments that we're currently making to GPs to come and work within the hospital as part of our new integrated care hubs. So there's a lot of work going on both locally within the hospital, but also we're talking to the deaneries, the Royal Colleges, to think about how nationally do we need to be making sure that training programmes, for example, for doctors are adapted and changing to reflect the needs of both the population we're serving and the individual organisation. So it's a really good opportunity for Tim to give an overview of that to the board and have a good conversation about that going forward. The board also spent a lot of time this month talking about the budget for next year. As with every bit of acute hospital at the moment, as financial position is very challenging, and next year promises to be equally difficult. Nationally, there's a lot of discussions going on about the tariff or price that hospitals are paid for their activity. But we spent a lot of time trying to balance as a board the opportunities presented by doing new things and wanting to invest in new developments within the hospital and new clinical services, with the obvious need to manage within our means and try and find innovative and different ways to deliver services that are more cost effective and efficient. So our budget is still in a draft form, is going to be submitted to Monitor, our regulator, at the end of this week, and there will be a further ongoing process of conversation with them, and also with our CCGs, the clinical commissioning groups that commission us to deliver services, with an aim that at the March board we'll be finally signing off the budget, obviously ready for the new financial year in April. So that was a lot of conversation about that, but a real willingness and acceptance from the board that primary purpose is to make sure that we're able to do the right thing for our patients and continue to deliver effective and high quality safe services, even if that can often mean it makes difficult financial questions more relevant for us, and sometimes means that we have to be even more ambitious in looking at how we bring in resources into the organisation to help fund some of the developments we see as so critical for us going forward. Finally, we also talked at great length at the board about the strategy of the organisation going forward. As I've often said, both in these videos and in other meetings around the hospital, the future for this organisation will look very different over the next few years. We can't exist anymore just as an isolated island within the hospital, as we need to work in a much more integrated way with GPs, community services, social care, as the needs of our population change and patients need a much more complex range of services coordinated around them. And we've got a very clear strategy as an organisation to do that, and particularly in how we work with GPs locally. We've been spending a lot of time talking to local GPs about how we could work in a more joined up way and an integrated way between hospital and GP services, and a large number of the local practices have signed up to want to work with us on that piece of work going forward, which builds on the work we've already been doing as part of our Symphony project over the past couple of years. NHS England nationally have also recognised that models of care have to change to meet the changing needs of the population and the economic challenge that we're all facing, and they've asked for sites across the country to put themselves forward to pilot these new models of care. And we've applied to be what's called a vanguard site for these new models of care, promoting the work we're doing locally with our GP colleagues. And we've been shortlisted to go up to London and talk to NHS England about that in the next week or so, and hopefully that will lead to us being successfully identified as a vanguard site to pilot these new models of care and really start to bring about some of the change that we need to see locally in the way the local health and care system is configured. And we've made some really good progress already, and some of you may well know that we are starting now our first Symphony Care Hub, which is an integrated care hub which will be operating out of Queensway Day Hospital. And the aim of that is to actually look after in a proactive way the most complex patients that are out in the community, working with GPs, social care, community services, specialists within the hospital, to really proactively manage that population of patients outside the hospital, so making sure that wherever possible we're caring for them in their own home or where they live, rather than bringing them into hospital and as an emergency or when crises have escalated, really getting our teams to be looking at how they work in a proactive way to coordinate the care for those patients, to keep them well in the community, but with the right support and advice from specialists in the hospital where we need to. So we've made some really good progress, and it'll be really good to see how that develops over the coming months, but hopefully by being part of a national programme we'd be able to make sure that we can also draw in support and expertise from people outside the area, and hopefully some resources as well, to ramp up and get our work going at an even greater speed to help transform the way we deliver services for our local population. So it was a really full and challenging board day, a lot of good conversations both about the here and now and the pressures we're facing today, with also the need to think about where we're going in the future and making sure that we can deliver a sustainable future for the organisation going forward. But an underlying recognition that the only way we can do this as an organisation is by supporting our staff and our people working here to do great things both now and in the future. So thank you again for all the effort you're making, and I look forward to updating you further at next month's, following our next month's board meeting. So thank you.